Hi, everyone. Welcome to Maxis Health's webinar today. We have a special guest, Dr. Rachna Sarokar, the Chief Medical Officer for Maxis Health. Dr. S., welcome, first of all. We really appreciate your time today. Could you take a couple of minutes and talk to us about what brought you here to Maxis Health?
Absolutely. It's a pleasure to be here, Monique. I'm a psychiatrist by training and also have a certification, board certification in informatics. And that combination, when I saw what Maxis Health was building, this incredible platform bringing together this community of families that is eager to improve their lives, the lives of their children, with the help of technology, that's really a calling for me. So I'm excited to be a part of it.
We are so excited to have you. There's so much technology promising to solve children's mental health challenges. What makes what we're building at Maxis Health different?
Right. So at Maxis, we're truly building this platform, right? And I'm sure a lot of our listeners hopefully know, but if you don't, we're literally building this ori platform that helps parents understand, manage, and improve emotional dysregulation in their children. And certainly, we are very much using technology and AI to do it. But I think it's important for us to dive a little bit into the reason we're using technology. It's not just because it's cool and fashionable. So let's think about, in an ideal world, the best child psychologists that exist, right? They almost have this sixth sense. They can go into a room, observe a family for 5 minutes, and pick up on things that can take the rest of us hours, weeks, months, years to ever notice, right? And it feels like magic, but it's not. It's decades of practice, decades of seeing children with very specific symptoms, and then those same children having certain outcomes, that they've developed this innate pattern recognition. And that pattern recognition is something that we can actually teach algorithms or AI to do. So again, let's go to an absolute perfect world. We have a psychologist living in our home 24/7, observing your child continuously. That's incredible, right? They get to see exactly when and how they get dysregulated, what they look like, what they sound like, what are the things that happen preceding that dysregulation. They can understand what interventions work best for them, notice how sleep or food or family interactions affect them. That psychologist would be the best tool any family could ever ask for. But that's not realistic on so many levels, right? So that's what we're trying to build, right? With technology, we can take the wisdom and that kind of sixth sense of a psychologist and bring that level of personalized, continuous monitoring and learning into every home. So a wearable watch combined with parents that are observing. And then the machine learning is the pattern recognition. And then the family coping coach is the intervention that Maxis has incredibly designed. And that all trains on your child's data over time. I think that's the kind of big picture goal of what we're trying to accomplish here. And I think this approach is very important for emotional dysregulation in particular, because emotional dysregulation isn't a cut and dry diagnosis, right? It's actually what we call transdiagnostic, because the dysregulation can happen across many different presentations and diagnoses.
You mentioned this happens across different presentations. Can you explain what you mean by transdiagnostic approach?
So trans means across, and transdiagnostic means that we're looking at something that cuts across traditional diagnostic categories, right? So major depressive disorder, Alzheimer's, ADHD, generalized anxiety disorder, oppositional defiance disorder. These are kind of classic DSM categories. Emotional dysregulation is a thread that runs through all of these different childhood mental health conditions. And a child who might eventually get diagnosed with ADHD often shows early emotional dysregulation and in very early years. So does a child who may go on to develop an anxiety disorder. So there are different conditions that will eventually need different treatments and supports. But when our kids are young, 3, 4, 5 years old, they're very rarely getting diagnosed with these disorders. And before the conditions fully emerge and differentiate, they can share this feature of difficulty regulating emotions and physiological stress response. And that's the opportunity we're trying to seize on here. So, right. So if we can detect physiological patterns of dysregulation early in life, before the specific diagnoses are even clear, we can identify kids who need support. We can start intervening during this critical developmental window. And we're not trying to predict which specific condition a child is going to develop, right? We're just identifying that their regulation needs support.
Okay. So the technology isn't actually trying to diagnose a specific condition.
Absolutely correct. We are not trying to diagnose, and that's very, very intentional. We're identifying the kids who are struggling with emotional regulation, which is, again, like I said, a risk factor for many different conditions. And we want to try to provide support for that regulation in the moment, right? And even now, before the kids go on to have bigger problems. So the because we don't want to wait, because we don't want to be in that wait and see mode, we want to try to use technology to identify the kids early. In really young children, that 3 to 8 range, we consider these almost invisible years for children because they don't have the language yet and the words to tell us how they're feeling. And some of us with older kids know that even if they have the language, they may not truly know what they're feeling, right? That takes a long time to have that skill. So we really believe that technology and digital phenotyping can give us a window into their emotions.
That makes total sense. Can we talk a little bit about the digital phenotyping? What does that term mean, and why is it important for understanding children's emotional patterns?
So digital phenotyping sounds a little technical, but the concept is pretty intuitive once you think about it. So in medicine, phenotype refers to the observable characteristics of a person, what we can measure and see. And traditionally, a doctor, I would assess phenotype through clinic visits, right? We observe a child, parents tell us what's been happening. Sometimes we do rating scales or questionnaires as well, right? But these are all snapshots, right, in a specific moment in the child's life. And they rely very heavily on memory and subjective reporting from parents, right? A parent is going to have to remember, oh, yeah, what did my kid look like last week after they had that meltdown, that really big one that prompted this visit in the first place? You're really relying on memory there. So in Maxis, we're using something called digital phenotyping to characterize a child's phenotype continuously, passively, and in their natural environment through data from wearable sensors and also from parent assessments in that moment. So we are trying to create almost a digital phenotype of regulation capacity. What we really want to help children do is learn to self-regulate. And we want to help parents understand, how do I help my child learn to self-regulate? So what we're trying to figure out and what we're collecting are the data that we need to understand that regulation capacity, to have that digital phenotype. So we're trying to understand, what does a child's baseline physiological state look like on a typical day? How rapidly do they escalate and how quickly do they recover? How well are they sleeping? How does food or water intake affect their behavior, right? And this is very fundamentally different from a 50-minute office visit once a month, because we're getting rich, longitudinal, and very, very objective data that we couldn't be able to obtain any other way. And for parents, that means you're not relying just on your memory anymore of what happened.
Which for some of us is very important.
Yeah.
Can you talk a little bit about ori itself and what it's actually measuring?
Sure. So Ori is a wearable biosensor designed specifically for children. So it's going to be like a kid-friendly band on the hand, and it continuously monitors several physiological parameters. So we're measuring heart rate variability, and this is important because it reflects how well the nervous system is managing stress. We're tracking skin conductance, which measures tiny changes in sweat gland activity. We're monitoring movement and activity patterns. And along with all of that information that we get from the wearable, we're tracking contextual information like sleep quality, duration, food and water intake throughout the day, and parents' observations about their children's mood and behavior. So there's a little bit of work certainly from the parents to be observing and putting the information in, but when we have all this data then in one place, it creates what we call a multimodal data stream with multiple types of information flowing together to give us the full picture of what's happening with the child.
And so that term multimodal, why is that better? What's so important about that?
Yeah, so multimodal simply means that we're combining data from multiple different sources, in this case, sensors and parents, right? And the reason this matters is that no single measurement tells the whole story about what's happening emotionally. Right. So this is fairly intuitive, I think. So as a parent, I'm talking to my child on the phone and can only hear their voice. And I might think that their mood is off, right? Or they're upset, but I can't be sure what exactly is wrong. But once I'm in the same room as them and I see them, I hear them, I can make eye contact, see their facial expressions, body language, and boy, do they have body language, right? I immediately have a much better sense of what their mood is like, right? So it makes sense. More data that I get into my brain, the much better idea I have of what my child's emotions are. And that goes the same with when it comes to digital phenotyping. When we combine all these different types of data from sensors, the heart rate, the movement, the sleep, the food intake, we get a much clearer picture of what's going on. And that's where machine learning and precision monitoring come in. So when a child first starts wearing Ori, we start what we call kind of like a learning phase. The algorithm starts to collect baseline data. We want to know, what do they look like on a good day, on an average day, on a tough day, after a full night's sleep versus a restless night, right?
Right.
And then over the first few weeks, we're building this initial physiological profile that's unique to the child, because there's a lot of individual variation, you can imagine, right, between one child to another. The patterns are not at all the same across children. So this initial monitoring period is very important. And then as we collect more and more data, our machine learning model, we call it OriSense, gets better at predicting for that specific child. Then we can predict when a child is going to have an emotional outburst based on their own unique baseline data and patterns. This is true precision medicine. And I love this because we're not trying to predict based off of just kind of generalities, right? We're really trying to predict based off of your own child and what they're typically like. And because it's machine learning, it keeps improving. Over time, false alarms will decrease, the timing of the alerts will get more accurate, and the intervention recommendations from the family coping coach will get more tailored based off of what's actually worked for this child and the family in the past.
That's interesting. And how is that different from a kid's fitness tracker?
So this is a very important distinction because obviously a lot of us have experience with wearables and fitness trackers already. So consumer fitness devices are designed to track physical activities and health metrics, right? They're counting steps, they're monitoring sleep duration, tracking heart rate, and those are very valuable for fitness goals, but it's fundamentally different from what we're doing. We're not trying to track your child's fitness. We're monitoring their emotional and physiological regulation. And so we can take a lot of the same and similar data points that those fitness watches do, but then we put them through different algorithms, much different validation and clinical design in order to give parents actually useful information, right? So we train our algorithms on patterns associated with emotional dysregulation in children. We conduct research studies to understand what the physiological changes look like when children are becoming dysregulated versus when they're just being active kids and running around and having a good time in the playground, right? Second, we're designing for a very young age group, 3 to 8 years old, which means everything from the sensor placement to the algorithm, all account for that developmental difference in young children versus adults. And most importantly, I think we're not just collecting data, right? I really like to always emphasize that from that data, we're providing true actionable guidance for parents through the Family Coping Coach app. I don't think it's ever enough just to tell a parent that your kid's not doing well, right? If we can't intervene in real time, it's not particularly useful.
So taking it that next step, that's helpful.
Yes. Yeah.
So there's a lot of excitement around AI predicting health problems, and I guess this is a two-part question. What can you realistically predict about emotional dysregulation? And then what are the limitations parents should understand?
Yeah, I appreciate this question because there is a lot of hype around AI in healthcare, right? And as of today, there is a lot that, we can already do, but there's a long ways forward. So we can detect patterns and the signals that a child is moving towards a dysregulated state, often with enough advance notice that we can alert the parent can plan an intervention, right? Sometimes we'll miss it. Sometimes we won't know till the child is in the episode, and that takes time and effort on both the part of the parent and the app to get to know the child, right? But early detection of something that's already beginning physiologically, something we can pick up with these sensors, this is personalized and doable today. We can do this. In fact, a recent study just from 2023 used machine learning with wearable sensor data to identify mood disorders in young children with up to 81% accuracy. This was, though, to say one study, one pilot, and we're really still quite far away from diagnosing. And so diagnosis, I think, is what we should be careful about. What that might be a very long-term goal in the industry, right? What before that will probably come what children are at highest risk for persistent problems. What medication might this child respond best to? These questions and finding out what diagnoses a child might grow up to have require much larger data sets, very different algorithms, and years of follow-up and validation. So we're still quite far away from doing that. Okay. Machine learning does find patterns, right? Like I talked about earlier, but every child is unique. Every family and situation is unique. So we're not trying to pretend that we're going to figure everything out, right? We're really building tools to support families and not make any definitive predictions about any child's future. And so we really want to dive in on that and not have any family say, oh, this will solve all my problems. This is a tool to help you.
It's a tool, right? So that brings us around to the idea, like, when should parents be concerned that technology may not be enough and they may need professional help?
Of course. Yeah, that's very important. So like I said, our technology is very much designed to support families, especially in that early space, when you're kind of wondering, well, is this tantrum normal? Or should I be worried? Is it a sign of something worse? What can I do to help? But it is not a replacement for clinical care when it's needed, right? Parents should still seek professional help if the dysregulation is significantly interfering with daily life. Like if your child can't participate in school, they're having trouble making or keeping friends, or if family life is completely dominated by managing their behaviors, right? Also, if you're seeing regression in skills, so things that they used to be able to do but can't do anymore, that's a red flag, right? Or if there's any concern about safety, either the child hurting themselves or anyone else. Or finally, if your gut is telling you that there's something more going on, right? I never supersede technology, and doctors can never supersede a parent's gut.
Mhm.
Right. So our goal is, again, if any of those things are happening, you always reach out for professional help. And I hope that our system can help facilitate that conversation with providers, right? So instead of trying to remember and describe exact patterns from weeks or months ago, you'll have some objective data that this is what the patterns look like. These are the strategies we tried. This is what helped. This is what didn't help. And that, for me as the doctor, makes clinical assessment much, much, much more efficient. Because otherwise many families will wait months to have the specialist appointment, and that first appointment is just spent gathering history, right? And then telling you, well, go home and spend another month gathering these more specific pieces of history. I need you to take notes. I need you to monitor for this. But if you arrive with that data already organized, you can work really, really fast towards developing an effective treatment plan.
It's amazing. It's also very exciting. So, Dr. S, I'd like you to look to the future a little bit for this last question. When you think about the future of pediatric mental health care, where do you see all of this heading?
So we're really at the beginning of this shift from a very reactive and episodic care model to something that's much more preventative and continuous, right, in pediatric emotional health. And I think for most of us that makes sense, right? So if we have a child, we see them struggle for months or years before a family reaches a crisis point, and then they look for help, right? At that point where, as a physician, I'm intervening when a family and a child is already significantly impaired. There are a lot of difficult patterns, both on the parent side and on the child side, that are entrenched, that have to be undone, will require significant therapy. It's kind of like undoing a lot of bad habits that built up, not because anybody did anything wrong, but because they were trying to survive through a difficult time, right? And that is a difficult thing to have to dig yourself out of, right? So instead, if we move towards a future, right, where the physiological monitoring becomes a routine option in pediatric care, right, where you say, oh, I'm not totally sure if this is good or bad, but maybe I can get that band for my kid and we can monitor and I'll get a better idea and I'll get some help in helping them manage their tantrums, manage their episodes of dysregulation. Now we can catch it early. We can identify when interventions are effective, and we can start to close that gap between something seems really hard, and we're finally getting support from, and that used to take years or months to get from that point to get to actual support. And now we should be able to get there within weeks, right? I think there's this amazing push that the industry is generally trying to make. They're trying the healthcare industry is consciously trying to shift towards prevention in healthcare instead of what we call sick care, right? I don't think we're doing a fantastic job. Most of our health insurance is still very much based off of sick care, but I think the conversations are happening more, and I really appreciate that. We are building a lot of tools to predict the next crisis and prevent it, which I think is great. And we are definitely using technology and AI to take that to the next level and use data to do that. But what I really wish we did more of was use technology and AI to figure out what helps our children do well, to figure out what makes our families happy, to figure out what actually gives us joy and meaning and purpose in our days, right? We spend a lot of time trying to prevent bad instead of using technology, using AI to make good, right? The more we use these tools to see what contributes to good days, faster resolution, the more we move from let's stop the bad thing to let's create conditions for the good thing. That is optimization and not just prediction. And I know it's a little subtle, but for me, it's also this mindset change that changes everything for families, right? We're not trying to stop kids from behaving badly. We're trying to give families tools to be happier, fundamentally just happier, right? And and so I really want, listeners to think about that and think about, well, what are the outcomes that matter to me? What do I wish Maxis could help me with. Um, you know, I think we want to change the way we think about, well, I don't just want fewer outbursts from my kid, but what I want are more dinners, more family dinners where we share stories, not just better sleep, but my kid loves going to sleep now. They want to have shared time reading a story before we go to bed, right? Um, and so I think that's what I hope we can work on together.
It's just such exciting times when it's all coming together. So I really appreciate you spending time with us today, Dr. S. Thank you so much for all of your insight and your compassion. Your energy clearly comes through, and it's really exciting to hear what's happening at Maxis Health. For our listeners, if you want to learn more, you can go to maxishealth.com. And the Ori app that we've been talking about is available on both the Google Play Store and the App Store for download. So thank you again for joining us and have a wonderful day.